Today I will teach you diseases that are very dangerous to the brain. If you're a new viewer, press the subscribe button and hit the notification bell. You are also welcome to share the video. These are the diseases that are very dangerous to the brain. 1. Infection diseases. The most common brain disease can be caused by an infection, including meningitis and encephalitis. Meningitis is an infection beginning around the brain or spinal cord. Encephalitis is an infection of the brain tissue. They often occur together and can cause neck stiffness, headache, fever, and confusion. They can be fatal without antiviral treatment. 2. Movement disorders. Parkinson's disease, ataxias, tremor, dysautonomia, tics, and Tourette syndrome are examples of movement disorder that often progress to a complete loss of function. They can lead to tremor or slow and stiff movement, loss of balance, speech impairment, and difficult walking. Parkinson's disease is caused by the loss of dopamine-producing brain cells. The causes of movement disorders can range from genetics to damage the brain, spine, and peripheral nerves, which leads to stroke. Though no cure is known, but drug and physical therapy treatments can help relieve some symptoms. Thirdly, neuromuscular diseases. These disorders attack peripheral nerves outside the brain and the muscles. They control amyotrophic lateral sclerosis, commonly referred to as ALS or LOU. Gehrig disease is the best known of the diseases, having taken the lives of the baseball player Gehrig and more recently the scientist Stephen Hawking. There are treatments to slow ALS or help the symptoms, but there is no cure. Another neuromuscular disease is peripheral neuropathy, which is caused by diabetes or chemotherapy or even genetics. It is characterized by pain, numbness, and weakness, usually in the hands or feet. For someone who has sustained nerve damage like peripheral neuropathy, needs nerve transfer surgery, which can be a treatment option. Number 4. Seizure disorders. Seizures are caused by a disruption in brain activity, either because of illness, brain damage, or other factors. Other seizure disorders include mesial temporal lobe epilepsy, post-stroke or post-concussive epilepsy. They may be caused by genetic anomalies. Its treatments are medication and surgery. Number 5. Stroke and vascular diseases. Stroke is the leading cause of permanent disability in adults. We have two forms of stroke. 1. Ischemic stroke and hemorrhagic stroke. Ischemic stroke is when blood flows to the brain, which is impaired by a blocked blood vessel. Its symptoms are sudden confusion, weakness in the arms or legs at one side of the body, and its treatment is by administering a blood thinning drug called TPA within 3 hours, which breaks the blood clot for easy flow of blood. Hemorrhagic stroke is when a blood vessel in the brain ruptures, causing bleeding in the brain. Surgery is often necessary for hemorrhagic stroke. The both kills brain tissue. Other diseases include vasculitis and fibromuscular dysplasia, which limit blood supply to the brain. Trauma. The CDC reported in 2019 that there were approximately 2.87 million traumatic brain injuries in the US, including over 837,000 occurring among children. Trauma includes confusion, which can be mid or severe, and can cause anything from headache to confusion, loss of consciousness, convulsion, and even death. Some forms of brain trauma can be found in military veterans and in athletics, most especially head trauma. Surgery and medication can treat it, and physical and behavioral rehab is also sometimes effective. Some lost function and sensation in their legs, which can be called paraplegic. Others become fully paralyzed from the neck down, so that they are unable to move and have no sensation in all four limbs. It can be difficult to restore function in such cases, but research suggests nerve transfer is one technique that may help some patients who have been fully paralyzed regain function in their arms and hands. Brain tumors. Both benign and malignant tumors can put pressure on brain tissue or even destroy tissues, which harms the problems in the body. Common brain tumors are metastatic brain tumor, having spread from another site; glioblastomatous brain tumor. This is the type that killed the late Arizona Senator John McCain, which originates in the brain. Astrocytomas, which originate in the star-shaped cells called astrocytes. Meningiomas, forming outside of the brain and the meninges, the membranes that cover the brain and spinal cord. Its symptoms include pain, headache, seizures, nausea and vomiting, vision or hearing problems, behavioral and cognitive problems, or motor and balance issues. Dr. Daniel Hall, an associate professor of neurosurgery at the University of Florida, says tumors can actually develop either in the spinal column, so within the bones, or within the spinal cord or spinal nerves, or in the space in between. Treatment for brain tumor involves surgery, radiation, chemotherapy, or combination of them. Newer and still experimental treatments, including gene therapy and immunological therapy, show promise for future tumor treatment strategies. So make sure you take care of your brain, because it is what makes us us.